Hello, everybody. I am Dr. Vundi Ogalo. I'm a consultant psychiatrist at Mathari National Teaching and Referral Hospital. And one of the things we are going to discuss today is substance use disorders. I'm going to highlight a few things that I would like you, as especially a parent, a caregiver, someone who has a loved one who has a substance issue, substance use disorder. So I want you to know that substance use disorders are not just something about bad choices or lack of willpower. It's a complex medical condition that affects the brain and the overall behavior of the person and their overall health. Substance use can affect people of all ages, all professions, and it can start off as seemingly helpless, the stage where they're just experimenting. But with time, we tend to see some patterns. We tend to see issues such as tolerance, whereby somebody starts being able to use a lot more of the substance to be able to achieve their high. You start seeing things like withdrawals. So that's when you can start realizing that as a caregiver, something has gone wrong. So there is that tolerance. They're using a lot more. They are going into withdrawals when they don't have the substance. And withdrawals can be anything mild from tremors, such as what we see in alcohol withdrawal, or it can be severe to whereby they are getting convulsions or psychosis. So if you have a loved one and you realize that when they are not using the substance, they're going into withdrawals, that suggests that the use is no longer experimental, and now we are dancing around the territory of addiction and dependence. That said, in as much as it is a complex medical condition, substance use is very much so a mental condition. So one of the things that we start seeing when somebody has abused substances for long is that they tend to start having psychological dependence. And then when they are not on the substance, they start having symptoms like anxiety. They start worrying about, where do I get my next fix? They can be very irritable and aggressive. One of the trending substance use issues that I cannot stop this video without discussing is vaping. And adolescents, young adults are vaping. It's a very, very common trend now. And some people see it as almost a safe alternative to smoking, which truly it is not. So if you're a parent, or even if you're using vape, I really want you to know that it's not as safe as it is marketed out to be. I've met some adolescents who say it's just flavored. It's flavored, but remember, it still has nicotine, which is highly addictive. And beyond nicotine, it has vape liquids, which contain chemicals at the end of the day, heavy metals, which are unregulated. We don't know how much is in those liquids. And we know that some of those liquids are carcinogenic, meaning they're cancer causing. So right now, you think you're having fun just smoking this trendy flavorful thing called vape, but there's the risk of dependence, there's the risk of anxiety, and later on down the line, you don't want to be told you have lung cancer or you have throat cancer, because those are the risks that vape carries. Another major overlooked concern that I wanted to conclude this video with is that there is an addiction that is caused by doctors. Yes, there's an addiction that is caused by prescription medication. Many individuals at first encounter some prescription medicines that have been prescribed by the doctor legitimately. But then after some time, they start being addicted to those medications, and then they start reaching out to chemists to obtain these medications without prescriptions. So we're talking about some medications that are used for pain, heavy painkillers, medicines used for anxiety, for sleep, when a doctor gives you some of these medications and they prescribe them for 1 week, sometimes patients become addicted to the feeling that those medications get them, and then they start bypassing the doctor and getting those medications. So I want you, as any individual, a caregiver, even doctors watching this, let's be careful for how we are prescribed. Let's be careful of how we are prescribing some of these medications. And let's be careful about what people are taking. Observe if you have somebody in the family, they're always going to the pharmacy, they're always going to the chemist. Watch out and find out, be keen. What are you always getting from the chemist? Because some of these pharmacists, we do know, are not really doing the thing that they should be doing, which is regulating some of these drugs. So we're talking about codeine, sleep aids, which fall into the categories of benzodiazepines. So basically, what am I saying? When we are tackling this issue of substance use, whatever the drug is, because I've mentioned many, but there are many more that I've not even touched on. Let's be our brother's keeper. When you see the telltale signs, which, as I said, were somebody um, having very bizarre behavior, for example, somebody always smelling like cigarettes or alcohol, somebody changing behavior, teenagers locking themselves in their room, getting very irritable, anxious. Those are the signs that somebody could be using substances. If you see this, please speak up. Please bring them to a mental health facility, such as Mathari Hospital, and the professionals will take care of the rest.